I wanted to give people a quick orientation to the VIHA manual. So you'll notice that on the units, the Ottawa manual is no longer available. That is our previous uh, IV drug therapy guide. So it's been replaced by the VIHA manual, which actually refers to the Victoria Island Health Authority VIHA. So basically, the difference is so instead of having a paper document, we have an electronic series of documents. They're PDF files. The advantage is that we can have them available on all the clinical desktops throughout the building. They're also customizable to our organization's needs, and they're also regularly updated. So there's always going to be, accurate and up-to-date information in them. So there's a huge advantage to going this way. It's a bit of a change of practice for us, so I'm just going to walk you guys through how to access these files. So instead of grabbing a manual and looking through the drug guide alphabetically, you're going to do so electronically. It's pretty much the same idea. So here's the you're going to see a folder on all your desktops that looks like this one. It may have a few little PDF pieces as well. It may look a little bit different, but it's going to have VIHA on it. Should be on all clinical desktops. If you do not see it on one of your clinical desktops, please reach out to IT and let them know so that they can push it forward to that computer, because it should be there. So go ahead and click on that folder and open it up. And when you open up that folder, this is what you're going to see. You're going to see a couple of folders and a couple of PDF files. So I'm going to walk you through this. So the first folder that you see is the monographs, the IV drug monographs. Okay, so when you open up this folder, you're going to have everything alphabetically ordered that is a intravenous drug. You can search for it just by scrolling down, or you can do all the Windows function Control F and do a search that way. So if we wanted to do a search for norepinephrine, for example, we could just pull it up that way. So once you open up these files, they're basically just a PDF file. Now your computer may ask you which app you want to use for the PDF stuff, so just use whatever the default is there. So you're going to notice that there's an IV direct, an intermittent infusion, and a continuous infusion direction. Some of the continuous infusion directions, you're going to actually want to go to a drug dose guide as well, which we do have a binder on ICU and Emerge for. And those files, I'm going to show you where they exist in this electronic resource as well. So you're going to get a monitoring piece. So this is often a question, what are we supposed to be doing for monitoring when we're giving these drugs? The VIHA manual actually addresses the monitoring piece as well. And then you're going to have your mixing and stability instructions here, any contraindications, any cautions or special instructions will also be indicated in there, adverse effects, things to look for. And then you're going to have your dosages. So it's going to go over what standard doses are. You're going to notice that most of these doses are going to be like microgram per kilogram per minute sort of increments, especially for your critical care drugs. So that's a bit of a change of practice for us in a lot of cases. So just be aware of the ranges that are recommended in the VIHA manual, because they may be quite different than what we're used to working with in terms of ranges. So that'll be a bit of an adjustment for you. So just be cautious about your doses. Make sure that you have your 0.1s and your 0.17s accurately indicated, and the 0.02s and the 0.05s accurately indicated, because those could have some impact. Our pumps and the libraries within the pumps have been reprogrammed to reflect these changes. So hopefully the pumps will not allow you to make the errors of putting in the wrong values there. As well as, so anything that comes out of expense as an order will be based on the information in this VIHA manual as well. So there's going to be congruity between all of those resources. So that's basically, in a nutshell, the monograms for you. And then if we close that window, we'll go back to our folder here. I'm just going to go back to the folders. Sorry. There. So within the folder, so we also have dose rate charts, so adult charts. So these I've printed out. Anything that you see with a line like this is stuff that I've printed out and put on the units for you. These are the drugs that we commonly use within our hospital, and those drug dosage guides look basically like the sort of graph tables that we're used to seeing in previous resources as well. So they're the same sort of tables that guide you to if you're going at this microgram per kilogram per minute and the patient weighs this amount, this is the amount that you should be seeing as your mils per hour rate. So very useful guides. And like I said, I've got them in both critical care areas for you. So just be aware of that. And then, so if we, again, these are all alphabetical, so you can scroll through them alphabetically, or you can do your Control F to search them as well. There's also a pediatric and NICU version of these drugs. Obviously, we're not going to be accessing those very often. However, it does happen that we do have pediatric doses that we're trying to calculate. So there is pediatric doses as well available to you. And then there's a few IM reconstitution charts. So some of the drugs that we administer as IMs, i.e. like Rocephin and some of the other antibiotics, we might give them as a IM injection. There is a guide for those as well. It's separate, so it's not going to be in your monograms. It's going to be in this adult IM reconstitution guide. And then you've got a reconstitution chart as well for IV drugs here. There's an extravasation, which we'll actually be updating our policy to match this, but there's extravasation information as well. And then you've got your NICU, which we're probably not going to be accessing too often, but there is some information there in a pediatric pump. So these two pump things, we don't currently have that equipment here, so we're not going to be using that, but they are there as a resource for us. In the event that we ever come up with these things later, or that a special circumstances require for us to access that. So that is basically your VIHA manual. So this thing should be available on all of your clinical desktops. Please do let us know if it's not there on one of the computers that you're using. And yeah, it should be pretty straightforward. I don't know if I can describe it any more accurately than that. If you have any questions or you have any concerns, please reach out to either myself or Anya, and we can maybe help you understand it a bit better. And yeah, that's the VIHA manual. So you will not be able to see Ottawa manuals anymore on the units. As of, I'm going to give it a couple more days, but as of Friday, you will no longer see Ottawa manuals. And you will have to go to these drug guides. And that's it.